Hi, Dr. Clinton here. It's been a year since I've done any procedure at all, and during this time, I am going to shape myself up here through the spring and summer and get my skin and myself back in shape. So, this is my very first procedure, and I'm doing ThermiVa. So, I have not done this procedure before. It's a radio frequency procedure, and it really helps with tightening the tissues in the female area. Many of you know I had cancer last year, and the chemotherapy that I went through really affected my ability to kind of everything to be right in that area. And for me, the feeling that I have is I had 3 children. I had no problem with leakage, and now I'm having a little problem. So Dr. Olah is going to take care of me with our ThermiVa procedure. I'll have to do 3 of them. Today is just the first one. I have not done one before. I am a little bit anxious about it, but I know I'm in good hands with Dr. Olah. So we'll see what I feel like at the end, and we'll get a little bit of information from Dr. Olah too about this procedure and her experience with it, because she is our women's health expert here at Timeless Skin Solutions. Thank you.
So the ThermiVa treatment that's going to work on our stimulating collagen stimulation in our vaginal tissues. So helping reduce those effects that some of us can get as we go through menopause or even as we approach menopause. Some of the changes in the vaginal tissues, including vaginal dryness, that thinner tissues that can cause that irritation, less lubrication that we can experience. It can enhance that and have more lubrication, as well as the stretch and the mobility of those tissues. As those tissues get narrower throughout menopause, that's very uncomfortable with intercourse or even just with exercise and walking. This can help that those tissues overall just become more healthy, therefore much more comfortable for the patient. As well as another great reason for this treatment is urinary issues. So incontinence, where we leak urine if we cough, laugh, or sneeze, or if we're leaking urine on the way to the bathroom. That kind of gotta go feeling. It can work on both of those symptoms and is a great treatment for those symptoms if they are mild. This is the probe that we'll be using. I think what I want everybody to notice here is just how small that probe is, about the size of the pinky. And it doesn't go in all the way in all patients, but it's the overall size, how small it is. Yeah. So depending on kind of what areas we're focused on, what the patient's complaints are, we're going to adjust that treatment. So we really customize that treatment for every patient. We give the patient and the time, tell them that they're going to be in the office about 45 minutes to an hour because of getting undressed and getting set up and whatnot. But in general, about 40, 45 minutes. It shouldn't be uncomfortable. It should be relaxing. Most patients, I learn, most patients we discuss, what is busy, what is crazy with life. I keep you talking the whole time, so you're really not even aware of what we're, what we're doing, but it is not uncomfortable. I agree, it shouldn't be uncomfortable by any means. So, for many years I treated women that had multitudes of vaginal complaints, from decreased lubrication after menopause, to painful intercourse after menopause, to mild stress incontinence. And to mild, what we call urge incontinence, where you have to go on the way to the restroom, or stress incontinence is when you have any leaking with cough, laugh, or sneeze. And we've treated those for years. There's medicines you can use, there's certainly surgery that you can go through, and some women just aren't ready to make that decision. This is a great procedure that can treat all of those symptoms. So for years we spent a lot of time treating those. I spent a lot of time treating a lot of those symptoms with different medications. Specifically estrogen, often for women that have issues with lubrication, or with painful intercourse, or with just the narrowing or the change in the tissues that occurs after menopause. And many women, estrogen is either not safe or they just are concerned about it. So it's recommended a treatment course of 3 treatments a month apart. But I tell you, many of our patients after the first treatments are noticing changes. So most of our patients after the first treatment notice a change. And then the results build on that. So after you get that treatment the first time and you notice some symptoms that are beginning to be less or start to resolve, each one of those treatments then builds on that base. So we get better and better results each time. as the symptoms begin to kind of wean or wear off, which we would expect about 12 to 18 months, then we just do another treatment. And it's only one treatment at that time. If it's a little closer, that's okay, meaning at 9 months, but often our patients are, they, you know, as they start to know some symptoms come back, they come in just for kind of a touch-up treatment, a boost treatment. If you've had any abnormal pap smears, or if you have any pelvic organ prolapse, any sort of prolapse, vaginal prolapse, then I need to do an exam and have that discussion with you or your gynecologist.
Yeah.
There's absolutely no downtime. So unlike some of the other treatments along that are similar to these, there's absolutely no downtime. There's no, you might get a little bit of a discharge after it, but there's no time to wait for intercourse. There's really no downtime at all. You might get if we're really treating bladder symptoms and some bladder issues, because we are stimulating some of those bladder nerves. Some folks will get a little bit of feeling like they go to the bathroom a little more over the next 48 hours. And that's probably just because we're stimulating some nerves in the bladder. So we have them call us if they're really concerned, but usually once I tell them that, they're like, okay, that's all that's happening. I know what's happening. This also helps kind of what we like to call as vaginal rejuvenation, meaning women who feel their tissues have changed after multiple vaginal deliveries. This does provide stimulation, collagen stimulation to all of those tissues. So kind of a tightening effect, which we've had many patients come in and be treated for and are very happy with the results.
All right, here we are. The procedure's over. It really didn't hurt at all. It was just a little bit warm. And Dr. Olah was just so nice and talkative and made me relax during the procedure. And I really want to say, I'm cured, I'm cured. I just don't know yet. I'll keep you informed. Thank you.